Well, Bronx then continues its coverage of the coronavirus and how particularly it affects New York City, more particularly right here in the borough of the Bronx. And on Saturday, April the 4th, New York State Governor Andrew Cuomo warned in his press conference the coronavirus has killed more people across New York State in a single day than it ever has before, and he fears the worst is still yet to come. New York City has more than 67,000 confirmed cases of the coronavirus, with the city's death count at more than 3,000 cases. The White House Coronavirus Task Force is now warning against going out to buy groceries or picking up medication in pharmacies, as the pandemic is expected to hit a deadly apex in the coming weeks. White House Coronavirus Response Coordinator Deborah Birx informed us, quote, the next 2 weeks are extraordinarily important. With more confirmed cases happening in the United States, President Trump stated this will probably be the toughest week. Between this week and next week, there will be a lot of death. Unfortunately, quote, there will be death. Also want to report that New York State Governor Andrew Cuomo has issued a stay-in-place order. The New York's pause will continue till April the 30th. It was originally thought to take place or end somewhere around the beginning or the middle of April, but the governor extending it now till April 29th. Well, Governor Cuomo also issued an executive order, this one now, allowing medical students who are slated to graduate to begin to be able to practice to immediately help with the healthcare crisis. There are 85,000 healthcare professionals, including 22,000 out-of-state individuals who signed up to volunteer as part of the state's surge healthcare force. Governor Cuomo said, quote, this pandemic has been stressing our nation on every level, and we're attempting to do everything in our power to prepare for the fight that will come at the apex. The state received medical assistance from Oregon Governor Kate Brown, who provided 140 ventilators. The state also received assistance from the Joseph and Clara Sy Foundation and the Jack Ma Foundation, which donated 1,000 ventilators and 1 million surgical masks, as well as 1 million N95 masks and more than 100,000 pairs of goggles. In other news, domestic and sexual assault survivors are trapped literally in their homes sometimes with their abusers, since the state mandated individuals to stay home. Our Bronx Net reporter Darissa Wright looks at this and brings us a story right now.
Since COVID-19 has forced people inside, home can be one of the safest places one could be amid the crisis, but not for domestic and sexual abuse victims. A record number 6.6 million people filed for unemployment benefits during the last week of March. In a study published by the Health Economics Research Group at the University of Miami, it found, quote, the financial challenges associated with unemployment could increase tension, anxiety, and family discord, thus leading to increased alcohol use. And alcohol is suggested to be a contributing factor in domestic violence. Jocelyn Veliz is a counselor advocate for Violence Intervention Program and says that isolation increases chances of continued abuse.
Before they had excuses to go out, right? I'm going to go food shopping. I'm going to go for a doctor's appointment, a school-related meeting or something, so they had ways of escaping home. Survivors are forced, for those who are living with their abusive partners, to stay at home. The abuse can happen in many different forms.
Veliz says the program has seen a decrease in calls to their 24/7 support line, but the silence could indicate an underlying issue.
We have actually seen a decrease in the calls, just because, again, this goes back to clients not having access to any way of communicating or reaching out for help.
According to a report by Politico, NYC Hope, the city's online domestic violence resource, saw a major increase in traffic to their website, over 1,200 visits in a 13-day period during the second half of March. Another concern could be that sexual assault survivors may think twice before going to a hospital to get a rape kit performed because of the shelter-in-place mandates. The International Association of Forensic Nurses issued a statement for sexual assault examiner nurses saying, in part, to communicate to patients seeking treatment, seek alternate care locations, and to strategize a plan for the increased number of patients during and after the stay-at-home orders. Jocelyn Veliz says the best thing to do during this time, if you are a victim of abuse, is to plan an exit strategy.
Planning with their their friends or family, like a code word, right? If I text you the word red, that means reach out for help. I need help. And sometimes they don't even have any room available. And we just like try to tell them, okay, even if you don't have the room, what is the safest spot that it's near an exit?
If you or someone you know is experiencing domestic or sexual violence, the Violence Intervention Program has resources available, including a 24/7 shelter. Reach out to the National Domestic Violence Hotline or contact RAIN. Reporting for BronxNet, Darissa White.
And thank you, Darissa. And BronxNet will continue its coverage of the pandemic and the coronavirus crisis and how it's affecting New York City. That's all the time we have for our Bronx updates. Stay tuned. We've got more show coming up right after this.